Mr. President.
Senator from Wisconsin.
Mr. President, I come to the floor of the Senate today to make a few points, to ask a few questions. First of all, can we all acknowledge that there's so much that we do not know about the coronavirus, about COVID, the disease, or about the COVID vaccines? Our response to COVID, as a result, has been in reaction to very imperfect information. So very early in the pandemic, I gave those individuals in a position to have to make very tough decisions with imperfect information, a great deal of latitude in making those tough calls. But over the course of the months, we have learned a lot. We've always been told to follow the science, but it sure seems our healthcare agencies, and as I refer to them, the COVID gods, the Dr. Fauci's of the world, the agency heads, the Biden administration, the mainstream media and the social media, they've never allowed second opinions. There's been one narrative, and they simply have not been willing to consider alternative measures. So a question I think we should all be asking ourselves is, did our response work? Over 780,000 Americans have lost their lives. The human toll of the economic devastation of the shutdowns, the year of lost learning to our children, psychological harm to our children, the record overdose deaths, increasing suicides. I don't know how you can take a look at America's death rate. The last time I looked, it's a couple of weeks old, about 220 per 100,000 population. By the way, Sweden was at 145 per 100,000 a couple weeks ago. I don't see how anybody can take a look at the response imposed in our country by the COVID gods and say it was a success. So, acknowledging the fact that there's still so much we don't know, I would appreciate a little modesty on the part of the COVID gods. I would appreciate that we actually follow the advice that I've always heard when dealing with a serious medical condition. Get a second opinion. Get a third opinion. But as I said, that's not allowed. I think it also calls for a little respect for our fellow citizens. These are some tough decisions. They're tough decisions whether or not you want to get vaccinated. Even more gut-wrenching and tough decisions based on these idiotic and pointless vaccine mandates is, do I subject to the coercion, to the pressure, to the fear of reprisal, and take the jab or lose my job? These are tough decisions. I'm a big supporter of Operation Warp Speed. I've had every vaccination until this one because I had COVID. The COVID gods aren't acknowledging natural immunity. They're not acknowledging vaccine injuries. They're not acknowledging the fact that even if you're fully vaccinated, you can still get COVID. You can still transmit COVID. So what's the point of the mandates? But of course, that's not what we're getting from the COVID gods. Now, this weekend, something happened that's not unusual. My words were taken completely out of context, twisted, distorted, and I was relentlessly attacked. I would like to respond to those attacks that were headlined, "Fauci calls Ron Johnson's aide comments preposterous." Fauci said, "I don't have any clue what he's talking about." Fauci blasts Ron Johnson for saying he overhyped AIDS. Preposterous. Anthony Fauci rips GOP Senator Ron Johnson's preposterous accusations he's overhyped COVID. So what did I say? That sounds terrible. Well, what I said was in response to a radio talk show host, Brian Kilmeade's question asking about the Omicron variant. He said, "It looks benign. I mean, mild symptoms, mostly people under 40. So I answered his question about Omicron, talking about Muller's ratchet. It's a phenomenon. It makes sense how viruses generally mutate, how they become more contagious because they want to replicate, so they become more contagious, but generally less lethal because it doesn't help replication if you kill your host. Now, nothing's guaranteed. That would be the general direction of the variants of the coronavirus. Why would we assume anything worse? But that's what the COVID gods are doing. They are assuming the worst. They are using every new variant to keep us in the state of fear that they have created to maintain control over our lives and rob us of our freedom, to impose freedom-robbing vaccine mandates, again, that are preposterous. There's a good use of that word. That are pointless, that are idiotic. But after talking about that state of fear, I went on to say, and by the way, Fauci did the exact same thing with AIDS. He overhyped it. Now, full stop. That is where the news media stopped. And then accused me falsely of downplaying AIDS. I have never, nor would I ever, downplay the tragedy that is AIDS, that is COVID. These are serious, deadly diseases. They've killed hundreds of thousands. I would never downplay them. When I said overhyped, I explained exactly what I was talking about in the next 6 words. I said he created all kinds of fear, saying it could affect the entire population when it couldn't. He's using the exact same playbook for COVID. And here's the key point that I want to talk about a little bit later. Ignoring therapy, pushing a vaccine. The solution to this pandemic, I've always thought, was early treatment. We still haven't robustly explored early treatment, and that's a travesty. Now, Dr. Fauci on the show said this criticism of him, creating a state of fear, is preposterous. But let's go to what he actually said back in May of 1983. Now, I was alive in May of '83. I understand how unsettling this new disease was. I understand the state of fear, the legitimate state of fear. But responsible health officials should not have stoked it, and Dr. Fauci did. He authored an article in the Journal of American Medical Association stating, quote, "The possibility that routine close contact, as within a family household, can spread the disease." He added, "If indeed the latter is true, then AIDS takes on an entirely new dimension. And then, if we add to this possibility that non-sexual, non-blood-borne transmission is possible, the scope of the syndrome may be enormous." Now, it's important to note, these aren't off-the-cuff comments. This was in a column he wrote with forethought. Dr. Fauci knew what a delicate time we were as the public's awareness of this disease was emerging, when people were already frightened by what they were hearing. He was in a position of authority. He knew what he said carried weight and would be disseminated, and it was. The following day, headlines in the United Press International published a story headlined, "Household Contact May Transmit AIDS." The next day, the Associated Press ran a story asking, "Does AIDS spread by routine contact?" The same day, the New York Times article read, quote, "Family contact studied in transmitting AIDS," and it invoked Fauci's article in discussing the possibility of transmission between family members. He stoked the fear, and it, quite honestly, continues to this day. He stigmatized AIDS patients for years with his fear-mongering. Now, less than 2 months later, in June of 1983, Dr. Fauci flip-flopped, and he publicly contradicted his own fear-mongering by stating, quote, "It is absolutely preposterous." He likes that word, by the way. "It is absolutely preposterous to suggest that AIDS can be contracted through normal social contact, like being in the same room with someone or sitting on a bus with them." I mean, you heard what he said 2 months earlier, right? If he felt it was so preposterous on June 26th, why had he raised the fear, stoked the fear, just 2 months earlier? Now, it's interesting, I just found out last night that not only did he write that article stoking the fear, he started giving interviews. I've seen an interview where he basically uses the exact same words, but now he denies it. He wants to deny the reality of what he said, what he did. He wants to rewrite history. And by the way, when it comes to the AIDS crisis, rewriting history, I'm not the only one that is accusing him of that. In an article published or updated last on December 6th in 2017 in the Huffington Post, in their comment platform, which I guess has since been taken down, an author of a book, his name is Sean Strub, wrote an article, wrote a blog for the HuffPost. The book Mr. Strub wrote was Body Counts, a memoir of politics, sex, AIDS, and survival. And he describes it as how he recounts how slow the federal government was in publicizing the use of Bactrim and other sulfa drugs to prevent PCP, which is the pneumonia that was then the leading killer of people with AIDS, in addition to its long time and well-known use to treat that type of pneumonia. So let me quote from Mr. Strub's article. He said, "Dr. Anthony Fauci is rewriting history. He is doing so to disguise his shameful role in delaying promotion of an AIDS treatment that would have prevented tens of thousands of deaths in the first years of the epidemic." The article goes on to say, in 1987, pioneering AIDS activist Michael Callan begged Fauci for help in promoting the use of Bactrim as PCP prophylaxis and issuing interim guidelines urging physicians to prophylax those patients deemed at high risk for PCP. The article goes on. Had Fauci listened to people with AIDS and the clinicians treating them, the doctors with the courage and compassion to treat AIDS patients, and responded accordingly, he would have saved thousands of lives. In the 2 years between 1987, when Callan met Fauci, and 1989, when the guidelines were ultimately issued, 2 years, nearly 17,000 people with AIDS suffocated from PCP. Most of these people might have lived had Fauci responded appropriately. Another doctor, Dr. Barry Gingle, I'm continuing with the article here, a medical advisor to gay men's health crisis, met with Fauci to plead for his support. They didn't just say there was, quote, this preliminary activity and some small trials, as Fauci claims. They explained that many frontline AIDS physicians, following the lead of Dr. Joseph Sonnabend, were already using Bactrim effectively to prevent the recurrence of PCP. The science was clear. A decade before, critical trials by Dr. Walter Hughes had proven its efficacy in preventing PCP in other immune-compromised populations, like children with leukemia. It continues. Fauci refused to acknowledge the evidence, and according to one account, even encouraged people with AIDS to stop taking treatments like Bactrim that weren't specifically approved for use in people with AIDS. Dr. Sonnabend wrote in 2006, quote, why in the case of AIDS was Bactrim, a known preventative measure against PCP, introduced so many years after a need for it had been recognized? To this must be added the question as to why this neglect, the consequences of which can be measured in the tens of thousands of lives lost, has received almost no attention. The media has continued to cover for Dr. Fauci. The article goes on, if we don't tell the truth about the history of the AIDS epidemic, it will be subject to more whitewashing, as we witnessed this weekend, my aside. More distortions and more rewriting to suit the legacies of the officials in charge. These are the same officials who seem incapable of ever acknowledging or taking responsibility for the mistakes they made, mistakes that cost our community thousands of lives. Now, Mr. President, why did I take so much time to read an excerpt from this article from 2017? It's because it's the major point I was making in my comments to Brian Kilmeade. Dr. Fauci, he's using the exact same playbook for COVID as he did for AIDS, ignoring therapy like Bactrim, or the cornucopia of cheap, generic, repurposed drugs that are available, that are being used successfully to treat COVID and save lives. The solution, is, I've always felt, has always been early treatment. But again, Dr. Fauci is ignoring therapy and pushing a vaccine. Why? There are medical experts, multiple medical experts that have looked at this, who are treating COVID, who are doing the research, who say upwards of 500,000 lives were needlessly lost because we ignored, and I would argue, sabotaged early treatment with cheap, generic, repurposed drugs. In fact, the FDA completely trash-talked one of these repurposed drugs, a Nobel Prize-winning drug termed by the World Health Organization as a miracle drug, ivermectin, calling it horse paste, saying, come on, y'all, you're not cows. Fake news stories saying that people are lining up, clogging hospitals because of overdoses of ivermectin, only to find out that is a completely false news story, like false studies published in medical journals that had to be withdrawn 2 weeks later, early in the pandemic, which also poisoned the use of some of these repurposed drugs. Let's take a look at some facts. Let's take a look at some facts that when I go on media and I describe these facts, I'm censored by the COVID gods. I'm removed from YouTube, as is sometimes the radio talk show hosts. But let's look at the facts of drugs versus the vaccine. Now, many of you will be shocked by this because this is all being censored. This information, this is not allowed. Again, there's one narrative. It's the narrative of the COVID gods. No second or third opinions are allowed. No questions are allowed to be asked, much less answered. So let's take a look at ivermectin. I've got two columns here. Total adverse events reported to either the FAER system, the adverse event reporting system from the FDA for drugs, and the VAER system, the vaccine adverse event system reported through the CDC. So the top three, first of all, ivermectin. Over 26 years of reporting. Ivermectin has about 3,756 adverse events reported in through FAERS. That averages, and by the way, so that's adverse events. In terms of deaths, it averages about 15 reports of deaths per year. Now, let's get something straight here. There are two main criticisms of FAERS and VAERS. It doesn't prove causation, I get that, but it also dramatically understates the adverse events. So again, we're going to use this as a comparison. Ivermectin, 15 deaths per year on average over 26 years of usage. Hydroxychloroquine, 23,355 total adverse events over 26 years. On average, about 69 death reports per year. How about the seasonal flu vaccine? Again, 26 years worth of history. 198,776 total adverse events reported on VAERS, but an average of 80 deaths per year for the seasonal flu vaccine. I mean, I look at these and I go, these are pretty safe drugs. No drug is 100% safe. No human body is exactly the same. But you have to look at these drugs as having a very safe and reliable safety profile. So, if you have COVID, and let's face it, the current NIH guideline on COVID is to do nothing. Go home, afraid, alone, isolate yourself, hope you don't get so sick you have to check yourself into hospital. The only thing they are recommending for use is monoclonal antibodies. Try and get those. I've talked to so many constituents that haven't been able to. Either they're not sick enough or they become too sick or it's taken too long. So virtually the NIH guideline continues to this day do nothing. Now, quick aside, how many other diseases is that the recommendation? Isn't it always early detection, allows for early treatment, produces better outcome? Of course that's what we recommend for every other disease except COVID, because Fauci ignored therapies and pushed vaccines. He's got his blinders on. Vaccines, vaccines, vaccines. And then they scaremonger both ivermectin and hydroxychloroquine. I don't know, are you afraid of those? If you got COVID, would you give those a shot? I certainly would. And by the way, I'm not a doctor, I'm not a medical researcher, but I've been in contact with doctors who have the courage and compassion to treat. And so when I have a friend or a constituent that calls me and say, what can I do? I refer them to a doctor who treats them. And I have example after example of these things working, keeping people out of hospitals and certainly preventing death. I know it's anecdotal, but the evidence is mounting and it's getting to the point of being irrefutable. I think it is at the point of being irrefutable. So now let's compare this to the drugs of choice of Dr. Fauci and the COVID guys. Let's take a look at remdesivir. The studies were weak. They changed the endpoint of reducing death because it didn't to reducing days in the hospital. But they still rushed through the emergency use authorization, and it has been the treatment, because it's blessed by the COVID gods, that hospitals will apply. Now, in fairness, hospitals also do dexamethasone. They will do other things, corticosteroids. Pierre Corey testified before my committee in May of 2020 about corticosteroids. But remdesivir is the big one. Over $3,000 a dose when these cost $20 to $50 total as part of a multi-drug, multivitamin, vitamin D, zinc. Remdesivir, 6,500 adverse events. I don't have it here. 1,612 deaths so far since it's got its emergency use. That's an average of 921 a year. That's remdesivir. Now let's look at the COVID vaccine. And this will shock you. It should shock you because nobody's talking about it. And when a guy like me talks about it, I get censored. I get vilified. I get attacked. 927,740 total adverse events. And remember, one of the criticisms is VAERS dramatically understates the number of adverse events. Total deaths, 19,532. Now again, I realize VAERS doesn't prove causation, but almost 6,000 of these worldwide deaths occurred on days 0, 1, or 2 following vaccination. I know Fauci, I know Janet Woodcock, I know Francis Collins are not concerned about this. I'm concerned about this. Other people who have been able to avoid the censors and see this, they're concerned about it. They're making those tough choices. They also realize COVID can be a deadly disease. They have to make an informed decision whether or not to get vaccinated. Shouldn't they have all the information? But they're not being given all the information. It's about time they are. Now, Mr. President, let me conclude by just asking for the audience, really, why do I continue to push these truths, and they are truths? There's no misinformation up here. This is the truth. This isn't mine. These aren't my numbers. This isn't my data. This is the CDC and the FDA's data. Why do I continue to talk about these things when I get attacked, when I get vilified, when I get ridiculed, when I get censored? It's pretty simple. It's because I've acknowledged the vaccine injured. I've held events to let them tell their stories. Like little Maddie DeGarry, 12 years old, now she's 13. She participated in the Pfizer trial. She's in a wheelchair. She can't eat. She has a feeding tube. Pfizer has ignored her, cast her aside. They're not paying for her medical bills. That's a scandal right then and there. Brianne Dressen participated in the AstraZeneca file. Paralyzed from the waist down. Fortunately, she's got her legs function back. But she's not whole. She's not cured. Ernest Ramirez, he lost his only son, his best friend. He's a single dad. I've given the vaccine injured, the survivors, I've given them a forum to tell their stories, and the media just shrugs. All they want is to be seen and heard and believed so they can be cured or so they can prevent other people from experiencing their trauma. The real reason I continue to tell the truth, although I'm attacked, is because not only have I given these individuals a forum to tell their stories, but I've seen their tears. I've hugged the vaccine injured, the surviving spouses, the surviving parents, the surviving children. Why won't we acknowledge these truths? Why won't we acknowledge the vaccine injured? Until we do, until we acknowledge what the root cause of their illness might be, how is there any hope of healing them? So again, Our response to COVID has been a miserable failure. We must acknowledge that. We can't deny reality. We need to embrace early treatment because we are going to continue to need early treatment. The vaccines aren't 100% guaranteed effective. New variants will emerge. We're going to have to treat. Better start now, and might as well give these cheap, generic, widely available drugs a shot. With that, Madam President, I yield the floor.